I've always been interested in Asian culture and art. My grandfather on my mom's side, I think 4 generations above him, came from Mongolia to move to Russia. And so there's this connection to lineage. And then I've always enjoyed martial art movies and Asian culture and things like that. And so starting off in Oriental arts, martial arts, and getting into going to massage school, and then going more specifically to Asian Oriental medicine, specifically with Jin Shin Jutsu, which is an acupressure-like modality with a lot of pulse diagnosis. I think I got really interested in pulse diagnosis and the specificity of how you can really listen to a subject and really hear what's going on, as opposed to objective material. So you can exactly hear what's happening in that moment, and that led to going into Chinese medicine with acupuncture, and always focus in on learning the traditional way, learning freehand needling before tubing, learning manipulation before using tools or machinery, things like that, and just continuing to go from a broader perspective, from like a gross of pain management to more specifically into pediatrics to women's health, so different modalities, and utilizing especially pulse diagnosis to lead that all to get a better diagnosis, and then going more specifically into needling, into injection therapy, and using proliferants, using a Chinese technique. So for instance, nowadays they use the term prolotherapy, and that means like proliferant therapy. And there might be different historical perspectives, but as I had read, and then in the Yellow Emperor's Classic, this is called the internal canon, or the Huangdi Neijing. And so in the 7th chapter, which is called the Ling Shu, that's all the different ways that you needle. And one of the ways they talk about is shoe point needling or kidney needling. And that basically is the technique of prolotherapy that was created 5,000 years ago, where you're hitting with a needle, whether it be a syringe or a needle, the attachment of the tendon or the ligament onto the bone. And so it wasn't until the 1930s that they added these proliferants. So instead of having to needle somebody 10 times with regular Chinese acupuncture needles, you can add a proliferant to it to make it happen much shorter, and I think probably with less pain.